obviously this has been a very busy time for you, but kind of just walk us through here what it's been like as you are getting prepared to take over for Dr. Lutz, and how has the department been preparing you to assume this role?
Yep. So, and I'm going to use something different than taking over for Dr. Lutz. I'm actually here as the interim health officer, which is a little bit different. But I can tell you that I've been here for about 3 days, and I have spent a fair amount of time with the multiple teams that we have, and because there are about 300 employees here.
Mm-hmm.
I have not met all 300 employees, but I've met a lot of the employees, particularly those that are front and center with the COVID response, as well as some of our public health issues like communicable disease, et cetera, which we can't forget we're taking care of too, not just COVID. And I am very impressed with the level of expertise and knowledge. And I'm more impressed as a community member with the level of commitment and dedication. I tell you, this team here has been going on full steam, long hours, 7 days a week for months, and they continue to do that. So it was fairly easy for me to come up to speed on the more immediate issues, just because I'm surrounded by people that not only are very knowledgeable, but are very willing to share the information. So they've been very welcoming, and I do appreciate that. And they don't mind me asking perhaps not very smart questions occasionally. So, so far, so good. But my goal is to make sure that I can support them, provide them guidance where needed, and help whatever I can. And likewise, they'll do that with me and for me, because at the end of the day, it's not what I can do, it's about what we can do.
Talk to me a little bit about just what got you on this path in the first place. I know that Al French was the one that had recommended you. Can you talk me through that process? How long have you known Commissioner French? What even started that ball rolling?
Sure. And I think there's 2 or 3 things that are happening, because this path, meaning the interim health officer, is a very short path. It's been a few days. But I can tell you that I had been participating in the COVID response in a variety of ways in the community. And one of those is I actually knew Dr. Lutz. I collaborated with him on a few things, and I have a lot of respect for him. So I had some line of sight to what the health district was doing from that perspective. I've known Commissioner French for, I don't know, several years since I've been in the community. Because as someone that has advocated for a lot of things in this community, medical schools, health sciences, and a number of other programs, obviously I've gone to all of our elected officials, both local, state, and federal, advocating for our community. So they all know me in some way, shape, or fashion as someone that has knocked on their door at some point, trying to get support for something in the community. So that's how I know Commissioner French. And this all started with a call one night last week, and I remember the night where Commissioner French called me and said, "Frank, how are you doing?" I said, "I'm doing fine, thank you." It was kind of an interesting call. And he said, "Well, what are you doing nowadays?" And I told him, "I'm mainly volunteering in the community, which is what I've been doing for the last couple of years on the various issues that you know as a why." Says, "Well, hypothetical case, in the event that we were to need some help with some of our clinical programs in the health district, will you be willing and able to help?" And he used a magic word help. Yeah, if you ask me, can you help? I'm probably gonna say yes. My wife tells me that I'm genetically inclined to say yes. But I said, Al, if I'm the right person and I can help, and that's what I can do for the community, I'm happy to do it. At that point, and that was last week, I didn't know what I was agreeing to, actually. And, I didn't have a very defined vision of it until Friday when I came here for the first time and started to talk to the people here. And actually, first call I got before I had even signed on any paperwork was for a communicable disease in the community, a disease that I haven't heard about a lot. So that really emphasized to me that this needed to get done. And I said, okay, I'm in. What do I need to do? So that's how this whole thing, so my path to Friday was a few days. And then it's been mainly Monday, Tuesday, and Wednesday. Although technically yesterday was a holiday, but I was here not because I want to say I'm wonderful, but because there's a lot of work that I needed to get done.
Are you going to be working full time, or are you going to be part time? How is that going to work, kind of in this interim capacity?
So technically, I'm supposed to be part time, but what I said is I'll put in the time that needs to be. I don't care what that is. And I wouldn't define the time that I've put in so far as part-time. But at the end of the day, whether it's 10 hours or 100 hours, it's irrelevant to me. The point is, what is it that I need to do? And how long it takes? Well, that's how long it takes.
Talk to me about what you have seen so far, and what do you think you need to do?
Well, so if you look at and this is something that I did last week before I came in on Friday, I actually look at the website of the Regional Health District Board, and I went through all the programs that we have. And I can tell you that I knew a little bit about many of those. I didn't know the depth and breadth of programs that we have. And by the way, I think for every community member, I think it would be a good idea to go and look, because the 300 employees here do a lot that perhaps we don't even know about, or sometimes may even take for granted because it's happening. So my role is to be the interim health officer with all of the responsibilities that brings to the table, from schools to public health, communicable diseases, COVID response, et cetera, et cetera. So all of those I'm doing. I've started to participate on a number of and we have virtual meetings with many of the teams that were supporting or providing guidance, like the schools, higher education, and others. So I've had, I don't know how many already, but we've had a lot of them. So my goal is to do three things. One, to provide the support and guidance that the staff needs so we can continue to deliver. Two, to make sure that we deliver to the community all the programs and processes that they expect and deserve. And three, that we continue working going forward despite anything that is in the rear view mirror right now. Because I tend to focus on the go forward, and go forward, we have a lot of challenges. I am confident on the team here. My biggest concern is always when people put hundreds and hundreds and hundreds of hours, occasionally I tell them, you may want to take a little bit of a break, because the human body only takes so much.
So let's talk about COVID specifically, because no one's really thought too much about the health department until this started. And then we realized quite all the things that were taking place kind of behind the scenes all the time. So you're coming in at this time where we are seeing so many cases spiking right now. What does that tell you about what we've done so far and what we need to move forward and get those numbers down?
So sure, and I have been, since the pandemic hit, I have been somewhat involved in a variety of ways. So I've had some line of sight to what we're doing and what we're saying. And I know that the health district, as well as many other entities, have been saying we will see increased numbers. So we are seeing those. And we're seeing those because we have more people in the community that are carrying the virus. And the more people that have it, well, the more people are going to get infected. That's almost a one-to-one relationship, and that makes sense. But I do also believe that we have been and need to continue being very specific about the public health policy guidelines that we have provided, of facial coverings, hand washing, social distancing, and disinfecting surfaces, and so on and so forth. And now we need to be even more diligent about it. And I will tell you why. And it's pretty simple. Because there's more people that are carrying the virus, the likelihood that one of us is going to come in contact with someone that could be asymptomatic, for all we know, because 40-45% of the people that have the virus are asymptomatic, is higher, but just by sheer numbers. So I think that's one issue. But in terms of the community, I've been part of the testing task force. When this whole thing started, I got called by one of the organizations, Life Science of Washington, which is a statewide organization. And I was asked if I could put together a small task force to look at testing capacity for the state. So I did that and passed that information along to the governor's lead for that task force. And I became part of the testing task force in the region here. And actually, Dr. Lutz and I connected about that time. And I collaborated with him on a few things, including we talk a lot about testing because that's one of my areas of expertise. So I have a lot of respect for him, and I continue to have professional respect for him. So what happened between employer and employee, it's a separate issue. But I have been somewhat close to it, and I do believe that what we've done thus far makes sense within the context of the outcomes that we've seen. And I also believe that what we do from here on as a community, not as me as a doctor, but we as a community, in being diligent in following the guidelines and recommendations we're providing, is what's going to determine how well we control this.
What does that mean exactly? What are we not doing already?
So, and I know it sounds boring and repetitive, but facial coverings, hand washing, sanitizing, and social distancing are the cornerstones. And I think we're doing it, but I also know that we're not doing it as diligently as we should in some areas. I don't want to say all areas, because I think I've seen a lot of, if you go to healthcare, for example, I think healthcare facilities have it down to a science. They're really, really stringent, as they should be. But if you go to other public places, I see a little bit of a lapse. And I do believe that people have a little bit of pandemic fatigue. And that's why Bob and I wrote that article about facial coverings, because we're going like, okay, we don't like the face mask. No one wants to wear that. But if that's what I can do to prevent me from infecting you or you from infecting me and then passing on to somebody else, you know, it's a minor inconvenience compared to everything else. So those are the things we need to do. And as we get into the winter months, when we're all going to be closer, that becomes more of an issue.
What about the holidays? What about gatherings? We know that we've consistently seen spikes pretty much after every holiday. So what do we need to do as we go into Thanksgiving and Christmas?
And, you know, we're all going through this. My wife and I were talking about this. We've been talking about it. And we would love to have, because we're very gregarious, so we'll love to have large gathering, but we're not going to. We're going to keep it to the household because we're concerned about the family, about us. We're concerned about people in the family. And although we can vouch for what we're doing, you cannot vouch for what everybody else is doing. So I looked at the CDC recommendations. I've looked at recommendations that have come out from a variety of entities. And it does seem that keeping it to a narrow group that represents your immediate circle that you actually know and have the history of what everybody's been doing and how is actually the best way to do it. If you're going to expand a little bit more, then I think facial coverings and some distancing, which we've done. We've done a couple of in the backyard outside. Unfortunately, it gets cold, hard to do, where you sit over there and we're sitting way over here with our mask. And yeah, we can talk like that, but it'll be more difficult as it gets colder. So and I know it's hard, I really do. And I know it's really, really difficult to think about Thanksgiving and Christmas and not being able to really spend the time with all the people that you want to. But it's one of the things we're going to have to do, unfortunately. It's a sacrifice, and I know it's a sacrifice, and that's why I call it sacrifice. I know it's a sacrifice, but we need to do it.
What about schools? We've seen some districts that have done hybrid schedules. Some are back mostly full-time. Some are staying distant. Now we're seeing these spikes, and some of those districts are starting to roll back and be more limited. Do you think there's more of that in the future? Do you think we need to be keeping kids at home away from schools right now?
So I think I've been looking at some of the plans from the various districts. And first of all, they're very well thought out plans with a lot of data and fairly complex analytics in them. And the reality of the matter is the transmission that we're seeing, we need to separate between transmission within the school and transmission to the school. It's two different.
Okay.
We do know, and we've had these conversations with the schools, that as the numbers in the community go up, it is more likely that either staff, teachers, parents, students will become in contact with someone that may be an asymptomatic carrier or is infected. So we have seen a little bit of that, and the schools have been really good at either pausing or rolling back a little bit what they have to do. I think we would like to continue in outcomes, measuring the outcomes. Because at the end of the day, we all know that for kids to be in school is eventually a good thing for them. It's good for their education, but we need to do it in a way that is safe for the student, for the faculty, for the staff, and for the families. So I think we'll continue monitoring this pretty much on a daily basis, and we're in very close contact with the school districts. And as cases increase in the community, unfortunately, I do think we're going to see contagion from the outside and coming from the community to people in the school as opposed to the other way around. Because if you look at the numbers in the school, they're fairly low that can be attributed to the school. Same as with healthcare. They're very low that can be attributed to healthcare.
Do you see in the next weeks or month any kind of rollback on restrictions in the community, going back to phase 1, for example, or some version of that?
Not to the best of my knowledge, not that I know of. So we're looking forward, and of course, as you pointed out, we're a week or two, I can't remember how far away from Thanksgiving. I'm losing track. But we do expect, unfortunately, that because there will be some gatherings, that we may see some numbers. So we're watching that very, very closely, because I think that will be the next kind of milestone that we're going to have to get through. But right now, we have moved forward, and unless there's guidance to the country, we'll continue to look at a measured approach as we've done.
So you don't have any intention as the health officer of rolling back any kind of restrictions, whether it's in the community or at the school district level?
Well, rolling back is a very strong word. And I would like to say, not at this point in time. We will follow the science and data and the outcomes, and that will tell us what we need to do. And I can tell you we're doing that very closely. We are in constant communication with all of the segments that you just mentioned, and we're gathering data on a daily basis and looking at it.
So people listening at home need to understand that that is a possibility if they don't perhaps change some of their behavior, keeping, family gatherings much smaller, wearing the masks, and doing the things that you guys have said.
Well, I think the message for the community, and I put myself as part of the community. I'm going to take my doctor hat off for a second. The best we can do to bring some additional measure of control and continue moving forward is for us to really follow all the recommendations that have been made, not only by the regional health district, but probably by every health expert in the state and in the country, which sounds simple. Facial covering, hand washing, social distancing, sanitizing surfaces as appropriate, and avoiding large gatherings, groups, etc. I think those are the things we can do to curtail this particular virus. And the virus is here, it's going to be here. And one of the things we have to remember, and this is where perhaps we don't think about it, somewhat different than some other communicable diseases, this particular virus has no preference for anything specific. We are all at risk. Anybody can get it. Any person, any age, any socioeconomic, it doesn't really matter. We're all at risk because the virus thus far doesn't seem to have spared any particular group that we know of.
You said that you don't want this position on a permanent basis. Why is that?
So I wanted to make clear that I'm not coming in to quote unquote take anybody's position, because I'm not. I was not thinking about being a public health officer until Friday, actually. So it's not something that I have pursued. It's not something that I have either aspired to or asked for, but it's something that I see as a call of duty right now for me. So I'll be happy to wear that title for however long I need to do that, just to make sure that we continue doing what we're doing in this regional health district. And remember, it's not just me, 300 people here. And I think the community needs to remember that part, that there's a lot of people here have been working really hard. So we need to support them.
You're coming in at a very controversial time based on what happened with Dr. Lutz, and I'm not going to ask you about any of the specifics of that, but are you concerned coming in at this time after what happened? Are you concerned at all about political influence in the public health realm?
And I'm gonna leave what happened in the rear view mirror. I'm looking forward. So I'm a physician first. I'm a doctor first, and I'll always be a doctor first. So for me, what we need to do from a public health perspective is number one, I will bring to the table all the facts, all the data, all the science, and have a discussion or conversation with whomever needs to have a conversation. I don't bring to the table any either political bias or influence, nor do I think is going to impact what I think we need to do. Because my job here is, and I put my doctor hat on Friday, and I'm not going to take it off until we're done. And that's what's going to guide me from here on.
Some have also criticized the health board for being made up of so many political voices and not medical professionals such as yourself. We have one naturopath and one dental hygienist. We don't have any MDs on the actual health board. Does that concern you that we have so many political voices?
Well, the way I look at it, and I think that some members of the board alluded to that, this is probably an opportunity for us to improve. And if I do believe that this will be a good time for us to look at everything, structure, composition, responsibilities. I always take every challenge as an opportunity to do better. And I do believe the board acknowledged the fact that there's some things that going forward we may have to do differently. I've been on many boards, and I can tell you board composition is always an interesting conversation. But I do believe that a board that oversees health should have, and it could be an advisory role. I mean, there's many ways of doing it. It would be good to perhaps get a little bit more communication, but they have alluded to some improvements.
There are also a lot of people there who are employees of the regional health district who very much supported Dr. Lutz. How do you intend to kind of heal the damage that exists of how things happened when his employment was terminated and reach out to all of the employees there in the health district as the new interim health officer?
So I think the best way to do that is by communicating, and I'm pretty honest about it. Like I said, I know Dr. Lutz, I collaborated with him, I have a lot of respect, that hasn't changed. But he's not here. The job needs to get done, and I'm here to get it done. And all I ask from them is the opportunity to be of help, assistance, and support to them. That's all I ask. Now, that there may be some emotion around it, I understand that. And I respect that, by the way. Because if people don't have feelings about things, I will be more concerned about it, actually. I think it's good that we do have emotion around it. But I want us to keep focused on moving forward and the job that we need to do. And that's all I'm here to do. What happened before me, I had no part in it. I had nothing to do with it. And I would prefer that we don't focus on it because that distracts from the job that these folks do every day really, really, really well.
How do you plan to work with the administrator, Amelia Clark, moving forward so as not to repeat some of the same things that happened under Dr. Lutz?
So I didn't know Amelia until Friday, actually. Personally, I know the name. And what I bring to the table is having had the opportunity to meet new people in many states, many times, in many organizations, in matrix organizations, in hierarchical organizations. I always do it the same way. I sit down and we have a conversation. Let's make sure that we know what we're doing, and you tell me what you expect, I'll tell you what I expect. We'll communicate, we'll agree, we move forward. And I think communication is key. And I tend to over communicate. I think it's probably the best way to look at it because I don't think there's ever enough communication. And the reason for that is communication has to be consistent and constant. And I think that's something that I've shared here with employees. We need to talk. We need to communicate just to make sure that we're on the same page all the time. And I think that's the best way to start a relationship. As I mentioned, I didn't know her before, and I'm looking forward to working with everybody here.
Is there anything as far as COVID response that you might change as far as how the health district and the community is handling COVID that was different maybe under Dr. Lutz and how you plan to do it?
Well, I think the district has been focused on not only what we're doing right now, but some of the aspects that we need to look for later, whether it's additional types of testing, whether it's vaccine distribution, et cetera, et cetera. So I want to make sure that we are keeping that longitudinal view. So I'm not changing anything today. If we were to change anything, it will be because the data and the outcomes tells us we need to realign whatever course of action we have taken. But right now, I think we have the here and now and the tomorrow. And my goal is that we work on both. Because at the end of the day, if we have a vaccine at some point, we are going to play a significant role in that. So we got to be ready. So we need to start talking about it.
Do you intend to carry on the same press briefings? At one point, we were hearing from Dr. Lutz a couple of times a week so that we could ask questions as the media about, how the numbers were going or any reasonings. Do you intend to kind of carry on that same schedule, or how are you going to address the community, and how will we as media members have access to you?
Sure. So I think we intend to continue the communications that we had. I think one of the things that I would like to do is, and I didn't watch all of the previous briefings, by the way, so full disclaimer. And one of the things I will do is maybe it won't be just me. And the reason for that is because we do have a whole large team of people here with a significant amount of expertise that are the subject matter experts on specific areas of this pandemic, that I think once in a while will be good for people to hear from. Because of what they bring, that hands-on activity. And will I become perhaps the more frequent or slightly frequently more seen public face? Probably, because that comes with the role. But I would like us to focus on the talent that we have, not just me, the talent that we have. But we'll continue communicating. I know that our communications officer, Kelly, is working on it. I know the first couple of days, they wanted to give me a couple of days to kind of like figure things out. Like I got lost in the building twice. First, they're doing construction, so it's kind of crazy. The loop. But so I had to not only acclimate myself a little bit, but more importantly, there were some ongoing efforts that I needed to focus on first, which I had to prioritize. And it's not that communication is not important, but we had some very specific efforts with education and higher education that we needed to pay attention to. So I focused on those my first 2 days.
Just to go back to kind of your medical experience, I know that you used to work at PAML. It sounds like when that changed hands, it is when you decided to leave PAML. Just talk to just a little bit briefly, kind of explain your qualifications, because it sounds like it's not necessarily in public health. So explain how that works.
Sure. So technically I have 3 different careers that are complementary and one builds on the other. So I did clinical work. I took care of patients, took care of cancer patients and HIV patients for many years. I actually set up one of the early HIV testing programs in the country, in the Boston area, and had to counsel people that were positive. So I've been around disease and communicable disease since the beginning of my career. I also work with some of the largest health systems, including public hospitals in the country, where public health, public policy, health and wellness and community programs were part of it. And I think what people are focusing on the last 10, 12 years of my career as an executive, which is the last career that I had, but they're forgetting that I had already a 25 plus year career in healthcare delivery in a variety of levels, including local, state, and regional levels. I also had a full academic career. I'm a professor and former chairman, so I run research and basic sciences. So I'm very familiar with that. I've collaborated with industry for many, many, many years in development of everything from, like example, one of my companies in California is a company, the manufacturing side of the company developed the H1N1 test while I was responsible for the company, and we were responsible for infectious disease clinical trials for new drugs. So I've been around this for a long time, Then I pivoted, went back to school, got a master's in healthcare management at Harvard. And the reason why I did that is because the program at Harvard was tailor-made for physicians and focused really heavily on public health and policy. To the extent that actually I got so interested in policy that I applied to law school and got into law school so I could do health policy. But then I deferred because I got a good job in Texas. We're opening a health system and I spent some time working with Parkland Health and Hospital Systems, probably one of the largest public systems in the country. I think Parkland and Cook County are the two biggest ones. And then pivoted to become more of an executive, which is where people know me from PAML. When PAML was acquired, LabCorp asked me to move to North Carolina with them, but we decided not to. We decided
Are you from Spokane, or how long have you been in Spokane?
About 9.5 years.
Okay.
No, I was born in Madrid, so I've come a long way.
Yes, it sounds like. What brought you to Spokane in the first place? Just curious.
I was recruited by PAML.
Okay, okay.
Yeah, I came here as the CEO of PAML and PAML Ventures, and when it was acquired, we chose to stay here. Then I took the time off and started volunteering in the community, which is pretty much what I've been doing. Now, as part of that, I've been asked by a few companies to provide them advice, and that, I'm doing that because it's kind of interesting to see all these wonderful companies, and I've tried to help a lot of the local companies. But I do have a significant amount of background that is helpful and useful with public health approach. I have not been a public health officer before. I'm sure that's a question that people have, but technically, to be qualified as one, I only had to take a 3-month course according to the state. And I have a feeling that 3-month course is probably going to be similar to the 2 years I did at Harvard in public health and policy.
Very similar, I'm sure.
Yeah.
My last question is really just based on a conversation that I had with Mayor Woodward. She was saying that some of her frustration came from feeling like there hadn't been collaboration lately, that there was one person making so many decisions that affected the entire county and the entire community. Do you intend to do things differently under your leadership?
Well, so let me paraphrase that and just tell you how I do things, which is the only thing I can speak about. So if you ask people that tell you that I'm a natural born collaborator, I tend to bring people together. I bring commonality of purpose, and I build consensus. That's just the way I am. It works with me. And that's what I've done pretty much everywhere that I've been. And that's what I intend to do. It's not a good thing or a bad thing. It's just the way that I feel that I can be most effective. Because one thing I don't do is I never criticize anything or anybody before me. I can only tell you what I will do. And what I will do is, to the best of my ability, communicate as much as I can, bring everybody to the table, make sure we don't have to agree. Actually, Bob and I did not agree on a number of things, and we still talk about it. But we talked about it, and that's all we have to do. Sit at the table, bring all the information, have a discussion, and we can agree to disagree, but at least we know what we're doing and why.
I'm curious, what did you disagree on?
So I'm a strong believer in deployable testing. So he was a little bit more conservative about it, or is more conservative. And it's probably because of my experience with testing. I do believe that deployable testing becomes a useful part at some point later, although we both agree it wasn't now. But I thought we could probably be sooner rather than later in the next few months or whatever, year, whenever it may be. So it's not, I don't think that we disagreed, is that probably I had more, a little bit more faith on the technology to get there, because I've worked a lot with these technology companies, but it is his job to be a little bit skeptical of these things. I mean, that's how you look at it. And now that I'm wearing this hat, I'll be very analytical about it and very critical. And whether I'm enthusiastic about it or not is irrelevant. It's the fact that does it work and does it do what I have to do? And that's one of the areas that I know the district before me was looking at. What other testing? I know the state is actually thinking, what other testing can we do? So that's a conversation that I can probably contribute.
We're almost out of time here. We only have 2 minutes left on the recording. Is there anything else that you'd like to add, just so that people can understand what they can expect with you now at the helm?
So they can expect a couple of things. First of all, they can expect me to take this job very seriously, because that's what I do. I think what we do is important. It's critical. and it's life-changing. And I take my responsibilities very seriously. I may not take myself as seriously, but I take my job very seriously. That's number one. Number two, the work here has continued to happen and will continue to happen because we have highly qualified people all over in this building that are doing their job every day. And then lastly, we as a community need to help them achieve our goals of better outcomes by really complying with all of the guidance that we've repeated before, like facial coverings and so on and so forth. So we as a community have a responsibility too.
Very good. Doctor, you've answered all of my questions. Thank you very much for your time. I appreciate it.
I appreciate it. Have a great day. Thank you.
Yes, you too. Bye-bye.
Bye-bye.